Here's a fully detailed and professionally written monograph on Indacaterol, structured clearly and deeply enough for medical, pharmacology, or nursing study use. Hashed Indacaterol, detailed drug monograph. 1. Generic name, drug class, brand names, and dosage forms. Generic name, Indacaterol. Drug class, long-acting beta-2 adrenergic receptor agonist, ELABA. Therapeutic class, bronchodilator, respiratory agent. Pharmacologic class, selective beta-2 adrenergic receptor agonist. Brand names, Arcapta Neohaler, US. Onbrez Breezhaler, Europe, Asia. Udebron Neohaler, combination of Indacaterol plus glycopyrrolate. Enerzair Breezhaler, Indacaterol plus glycopyrronium plus mometasone. Dosage forms, inhalation powder, capsule form for oral inhalation using a specific inhaler device. Available as single ingredient or fixed dose combinations with other bronchodilators, corticosteroids. 2. Definition. Indacaterol is a once-daily, ultra-long-acting B2 adrenergic receptor agonist, ELABA, used for maintenance bronchodilator therapy in patients with chronic obstructive pulmonary disease, COPD, including chronic bronchitis and emphysema. It provides 24-hour bronchodilation by relaxing airway smooth muscles, improving airflow, and reducing COPD symptoms such as shortness of breath. It is not indicated for asthma treatment or acute bronchospasm relief. Number 3. Mechanism of action, pharmacodynamics. Indacaterol selectively binds to B2 adrenergic receptors in bronchial smooth muscle. This activates adenylate cyclase, increasing cyclic adenosine monophosphate, CAMP levels. Elevated CAMP leads to activation of protein kinase A, pKa, which phosphorylates and inhibits myosin light chain kinase. The result is smooth muscle relaxation and bronchodilation of the airways. Effects begin within 5 minutes of inhalation and last 24 hours, allowing once-daily dosing. Selectivity. Highly selective for B2 over beatmine receptors, minimizing cardiac side effects, though not eliminating them. Now, number 4. Pharmacokinetics, parameter details. Absorption, rapidly absorbed after inhalation, systemic bioavailability 43 to 45%. Peak plasma concentration, Tmax, reached in 15 minutes. Distribution, widely distributed, plasma protein binding 95%. Volume of distribution is large, indicating extensive tissue uptake. Metabolism undergoes extensive hepatic metabolism via UGT1A1, glucuronidation, and CYP3A4 oxidative pathways. Minor role of P-glycoprotein, PGP. Elimination half-life, 40 to 52 hours, enables once-daily administration. Excretion, 54% excreted in feces, 23% in urine, mainly as metabolites. Steady-state concentration, achieved within 12 to 14 days of daily dosing. Number 5. Therapeutic uses. Chronic obstructive pulmonary disease, COPD, long-term maintenance treatment of airflow obstruction. Chronic bronchitis and emphysema, reduces symptoms such as dyspnea and improves exercise tolerance. Combination therapy, often combined with anticholinergic agents like glycopyrrolate or inhaled corticosteroids for enhanced therapeutic effect. Number 6. Indications. Maintenance treatment of airflow obstruction in adult patients with COPD, including chronic bronchitis and emphysema. Not indicated for the treatment of asthma or for acute bronchospasm. Number 7. Contraindications. Hypersensitivity to Indacaterol or any component of the formulation. Use in asthma. Contraindicated without the use of inhaled corticosteroids, as ABA monotherapy in asthma increases risk of asthma-related death. Acute respiratory conditions. Should not be used for immediate relief of acute bronchospasm. 8. Before taking this medicine, precautions. Cardiovascular disease. Use cautiously in patients with arrhythmias, ischemic heart disease, hypertension, or heart failure. Seizure disorders. Beta agonists may exacerbate convulsions. Thyrotoxicosis may worsen symptoms of hyperthyroidism. Diabetes mellitus may cause transient hyperglycemia, monitor blood glucose levels. Electrolyte imbalance may cause hypokalemia, monitor potassium levels, especially with concomitant diuretics. Lactation in pregnancy, use only if the potential benefit justifies potential fetal risk, pregnancy category C. Renal or hepatic impairment, no dosage adjustment typically required, but monitor for systemic side effects. Number 9. How to use Indacaterol. 1. Use once daily at the same time each day. 2. Use only with the provided inhaler device, Neohaler or Breezhaler. 3. Do not swallow the capsule. It is for inhalation only. 4. Administration steps. Remove a capsule from the blister pack just before use. Insert capsule into the inhaler chamber. Pierce the capsule by pressing the side buttons. Inhale rapidly and deeply through the mouthpiece. Hold your breath for 5 to 10 seconds. Discard the used capsule. 5. Do not wash the inhaler. Wipe with a dry cloth if needed. Number 10. Dosing information. Adult dose, COPD, Arcapta Neohaler, 75 milligrams once daily by oral inhalation. Combination inhalers. Udibron Neohaler, Indacaterol 27.5 grams glycopyrrolate 18.6 milligrams, 1 capsule inhaled once daily. Enerzair Breezehaler, Indacaterol's glycopyrronium plus mometasone, 1 inhalation once daily. Maximum dose 75 milligrams daily as single agent. Onset of action, 5 minutes. Duration, 24 hours. 11. Missed dose and overdose. Missed dose. Take the missed dose as soon as possible. Skip it if it's almost time for the next scheduled dose. Do not double doses. Overdose. Symptoms: tremors, headache, tachycardia, palpitations, nervousness, chest pain, muscle cramps, hypokalemia, or hypertension. Management: symptomatic and supportive treatment. Cardioselective beta blockers may be considered cautiously if severe cardiovascular symptoms occur. Monitor cardiac rhythm, blood pressure, and electrolytes. Number 12. When to stop or avoid taking. Stop using Indacaterol and seek medical attention if you experience paradoxical bronchospasm, wheezing immediately after inhalation, chest pain, rapid heartbeat, or irregular pulse occurs. Allergic reactions such as swelling of the face, lips, or throat appear. Worsening of breathing symptoms despite regular use. Avoid using with other long-acting beta agonists less. Using as a rescue inhaler during sudden COPD attacks. Number 13 side effects. Common 1%. Cough, immediately post-inhalation, nasopharyngitis, sore throat, headache, dizziness, myalgia or muscle cramps, nausea, mild tremors. Less common, palpitations, tachycardia, dry mouth, rash or pruritus. Serious adverse effects, paradoxical bronchospasm, cardiac arrhythmias, especially in patients with cardiac disease, hypokalemia, hypersensitivity reactions, angioedema, urticaria, rash, increased blood glucose in diabetics. 14. Vital patient information. Indacaterol is for maintenance therapy only, not for emergency relief. Always keep a short-acting rescue inhaler, like albuterol, available. Do not exceed prescribed dose. Rinse mouth after use to minimize irritation. Report any new or worsening cardiac symptoms or breathing problems immediately. Continue using daily even if you feel better. Discontinuation may worsen COPD symptoms. Number 15. Drug interactions. Class, interaction effect. Beta blockers, e.g. propranolol, metoprolol, may reduce bronchodilatory effect of Indacaterol. Avoid unless necessary. MAO inhibitors, tricyclic antidepressants, potentiate cardiovascular effects of BD2 agonists. Use with caution. Other adrenergic drugs or LABAs, additive sympathetic effects, tachycardia, tremor, hypertension. Diuretics, loop or thiazide, may enhance hypokalemia. Corticosteroids or theophylline may also increase risk of hypokalemia. CYP3A4 inhibitors, e.g. ketoconazole, increase systemic exposure, but usually not clinically significant. Thank you. Have a nice day.